Hello, my name is AMIRUL AFNAN RUSLI. My metric number is 42422030002. I'm from DPY 35, and in this video I will talk about objective assessment of the cervical spine. Firstly, objective assessment is to identify the presence of any organic musculoskeletal physical impairment related to the patient pain. The first thing to do in objective assessment is observation. The aim is to observe the patient posture both in standing and sitting position. From the anterior view, the chin should be in line with the sternum, and the lateral view, the ears should be in line with the shoulder. If is it not, there is one of indication of the upper cross syndrome. As for the posterior view, the relationship between the CS or the cervical spine and the rest of the spine should be observed carefully to indicate if there is a scoliosis present or not. Next, the examiner should ask the patient to do some active movement to reproduce their symptom. If the pain are dominant, the movement only to the point in the range where the pain start to begin. If the stiffness is dominant, movement are taken to the limit of the available range. Movement that can be done by the patient is the flexion, extension, rotation, and side flexion, or any combined movements. All movements are performed with overpressure if necessary. Slight auxiliary movement at the end of the range of motion also needed. Moving on to the passive movement, the examiner should look for hyper or hypomobility, instability, or spasm in the cervical area. The examiner can do this by PPI-VMS and PAI-VMS. The first one is passive physiological intervertebral movement. This is where the examiner palpate between the adjacent spinal process to feel the range of the intervertebral movement. During the upper cervical, the flexion and extension, lateral flexion and rotation. As for the PAI-VMS or passive accessory intervertebral movement, the pressure, it is where the examiner pressure the posterior anterior through the tip of their thumb against the spinous process. This treatment also can be used as a way to reduce pain. Then peripheral joint screening also important to test other closed joints such as shoulder joint and temporomandibular joint, which is the closing and opening of the mouth that is close to the cervical spine. Then checking the myotomes and dermatomes that related to the cervical area are also needed. For myotome, it can be tested with a resisted isometric movement where the examiner instruct the patient to don't let me move you and give resistance for at least 5 seconds. The movement related to the cervical myotome such as neck for C1 and C2 and elbow flexion or wrist extension for C6. As for dermatomes, it is to test the sensory area provided by the cervical area. It can be tested with a pinprick for pain test, curtain for light touch test, and test tube with hot and cold water for thermal test. Then there is also a special test to provoke the patient's symptom. This test is begin by testing the unaffected side first. we will be looking two examples for this special test. One is purling test and distraction test. Firstly, let's take a look for the foraminal compression test or purling test. This is basically the compression of the head in these three positions, which is neutral position, head extension, and rotate left and right with extension. The test is positive if the pain radiates into the arm during the rotated side compression. Moving on for the distraction test. Place one hand under the patient's chin and the other hand around the occiput, then slowly lift the patient's head. The test is positive if the pain is relieved or decreased as the head is lifted or distracted. Finally, the examiner can test the reflex that related to the cervical spine, such as the bicep tendon for C5 and C6. It is done with a tendon hammer. Other example we can see here in the picture for C5, C6 and C7. So that's all for this video, and thank you for listening.